Hello, Health IQ family. Welcome back. Today, we're diving into one of the most important topics for new moms and babies, breastfeeding. And we've got expert advice from none other than Dr. Jack Newman, a leading pediatrician and breastfeeding advocate. We're covering everything from the health benefits to the best practices for latching, milk supply, and beyond. Let's get started. The importance of skin-to-skin contact. Right after birth, it's crucial to establish immediate skin-to-skin contact with your baby for at least 2 to 4 hours. Because your baby has been inside you for months, and this skin-to-skin time helps make the transition to the outside world smoother. This connection isn't just for comfort. It helps stabilize the baby's heart rate, breathing, and body temperature.
Yes, it's extremely important for a baby to be skin to skin with the mother immediately after birth. Not for just 5 or 6 minutes. Yes, but for a full hour or two. Really does wonders for the baby. And the studies show that the mothers and the babies who are kept skin to skin are usually breastfeeding longer and more exclusively than those babies that are separated. Furthermore, the babies cry less if they're skin to skin with the mother.
Colostrum. Liquid gold. Let's talk about colostrum, also known as liquid gold. This is the very first milk your body produces, and it's packed with essential nutrients like vitamin A, magnesium, copper, and zinc. Colostrum is rich in antioxidants, antibodies, and other compounds that feed good bacteria and kill harmful bacteria and viruses. Getting enough colostrum is critical for preventing newborn conditions like jaundice and low blood sugar. But how does your baby get it? Well, that brings us to our next point, latching. Latching the right way. A good latch is everything when it comes to breastfeeding. Poor latching can cause sore nipples, inadequate milk intake, and frustration for both mom and baby. So, how do you know if the latch is right? Here's a quick tip. Push your baby's chin closer to your breast and make sure their mouth is wide open. You want their lips to be flanged out, covering the areola, not just the nipple.
The baby latches on here, that's what the baby gets. But if the baby latches on here, there's still lots of milk.
How and why it is so important to latch correctly is to give them the analogy of having a whole pile of straws in their breast. So if you have a whole bunch of straight straws, maybe there are 15 to 20 to 25 of straight straws in the breast, and you latch baby on correctly so that the chin comes in the breast and not the nose, you'll get nice flowing of the milk through the straws. Okay, so let's point out what's so different, why this latch is what you're calling the miracle. Very often moms are pushing the nose into the breast, and when that happens the nipple will then go centered in the mouth, and that causes pain. So we don't want that. We like to keep the nipple pointed up towards the roof of the mouth. See the nipple inside the mouth pointing that way. Well, how do I know it's pointed that way? If the chin is in the breast touching and the nose does not, so I can actually pass my finger through here. There's no touching. That means that the nipple must be pointed up. And you can imagine with the areola here, an asymmetric latch, we see more areola there. The rest looks like it's disappearing in the mouth or jaw. It shows me that the nipple is pointed up to the roof where it's protected. But something else happens. Not just is the nipple protected, but now baby gets more milk, because now baby can get this area of the jaw around the parts of the ducts which act like milk sinuses and help to compress on that and use the tongue to help bring the milk along those ducts. So that way baby can get much more milk this way than just being on the nipple or just having the nipple centered in the mouth. So the way to get there is to have your positioning right. So bodies of the baby is in a straight line, and the bum is tucked tight here. Tight. Good. Fingers are underneath the face. Good. So we support the weight of the head here. We're on the baby's skull, not on the neck. Good. This way the weight of the baby is taken here and not on the head.
When your baby is latched well, breastfeeding becomes smooth and efficient. Next, is your baby getting enough milk? So, how do you know your baby is actually getting milk and not just sucking? Watch their chin. If their chin is moving rhythmically, with short pauses, that means they're drinking, not just sucking.
We try to teach the mother to latch the baby on in such a way that when the baby's on the breast, his chin touches the breast, his nose usually doesn't, even if the mother has very large breasts. The lips are usually flanged outwards, like that, and the baby covers more of the areola with his lower.
If your baby is sucking but not drinking, that's where breast compressions come in. Breast compression. Breast compressions are a great way to help your baby get more milk. Firmly, but gently, compress your breast while your baby is feeding. This turns a suck into a drink. Remember, if your baby is just sucking without swallowing, it's time to use compressions or switch to the other side of the breast.
Baby is only nibbling at the breast, then he's going to spend a long time there. He's not going to be getting very much milk if he's only nibbling at the breast. So we suggest to the mother, get your hand around your breast, and if the baby's just nibbling while he's sucking but not drinking, then squeeze. And that will often get the colostrum, or even if it's later, get the milk flowing, and the baby will start to drink again. So if you see that the baby's not drinking, then squeeze. The baby should start to do some of these pausing types of suck. Keep the pressure up. If the baby is no longer drinking, then release the pressure. Wait for him to start sucking. If he's not drinking, compress. And keep the baby drinking that way until he doesn't drink anymore, even with compression. You get that baby breastfeeding well, you won't need to do any supplementation. So finish one side as well. How do you know the baby's finished? Well, because the baby's not drinking anymore. So take him off if he's really not drinking anymore, and then offer the other side. And of course, there's no reason you can't go back and forth several times.
Milk ejection reflex and preventing sore nipples. The milk ejection reflex, also known as let down, is when your milk starts to flow freely. It's a good sign. To avoid sore nipples, make sure your baby is latching correctly.
And what's the treatment for sore nipples? A good latch.
If you're experiencing pain, reposition your baby or consult a lactation expert. A well-latched baby should not cause pain.
Unfortunately, too often, sore nipples are considered a normal part of breastfeeding, but they're not. Okay, so what do we do for sore nipples? The best treatment for sore nipples is prevention. We get that baby latched on well from the very beginning. If we get that baby skin to skin with the mother so the baby latches on all by himself, that baby will latch on well and the mother won't have pain. And I think that this is the one thing that we can do for mothers that is just incredible, because it can be painful. In fact, a lot of mothers say it's worse than labor. Well, it shouldn't be that way.
Supplements and lactation aids. Sometimes, supplementation might be necessary. But instead of jumping straight to formula, Dr. Jack Newman recommends using a lactation aid. This way, your baby continues to learn how to breastfeed and your milk supply stays steady.
Supplementing may be necessary from time to time. There are truly women who haven't produced enough milk or won't produce enough milk, partly because the baby got off to a very poor start, partly because, in fact, some women just cannot produce enough milk. Most of the time, supplementation, when it's given, is not necessary, but there are those occasional circumstances. Ways to supplement are legion, but there are better ways, and ways to supplement are worse ways. We tend to use what I call a lactation aid, which is a tube that runs from the supplement along the mother's breast so that the baby is breastfeeding, but at the same time is getting this extra supplement. This is a very important way of supplementing. It's superior to other methods because the baby is still breastfeeding. So what I often say is that Babies learn how to breastfeed by breastfeeding, and mothers learn to breastfeed by breastfeeding. And if the baby is being supplemented at the breast, then the baby continues to get the mother's milk even though he's being supplemented. Babies won't reject the breast if they're being supplemented in this way because, as far as they're concerned, they're getting milk from the breast. When we give babies bottles or other methods of supplementation, babies can sometimes learn very quickly that they're getting milk from somewhere else other than the breast, and many babies will then start to refuse the breast altogether. Even if the mother's not able to produce all the milk the baby needs, there's still much more to breastfeeding than just the milk, so that the mother can continue to breastfeed if it's at all possible. And this is why we teach the mothers how to use it properly. What we tell the mothers is first, here's how to get the best latch possible. The better the latch, then the less the mother will need to supplement the baby. The better the latch, the easier it is to use the supplementer, and the better the latch, the sooner the baby will get off it. Then we teach the mother how to know the baby is getting milk.
Remember, both babies and mothers learn how to breastfeed by breastfeeding. It's a skill that takes practice. Next, the best start. Tips for new moms. To give your baby the best start in breastfeeding. Practice good positioning. Use skin-to-skin contact as much as possible. Feed your baby as soon as they show early cues. Crying is a late cue, so watch for those earlier signs. Don't force or resist your baby when they are upset. Use compressions to keep the milk flowing if your baby is sucking without drinking.
Drinking, then release the pressure. Wait for him to start sucking. If he's not drinking, compress. And keep the baby drinking that way until he doesn't drink anymore.
Dealing with a colicky baby. Colicky babies can be challenging when it comes to breastfeeding. The key here is patience and not panicking. If your baby gets angry or refuses the breast, stay calm and try again later. Using skin-to-skin contact and ensuring a good latch will help.
Babies, of course, can be colicky for many reasons. The incidence seems to be less in breastfed babies than it is in formula-fed babies, but it does occur. One of the big helpful things about colic is that no matter how long and how difficult it may seem, it eventually gets better. The real issue is not how long the baby's on the breast, but how well the baby breastfeeds. So what we tell the mothers is, for example, milk increases in fat as the baby nurses longer. If the baby gets more high-fat milk, the baby is less likely to be colicky. But just keeping the baby on one breast doesn't make sure that the baby gets higher fat milk. When the mothers no longer see the pause, instead of letting the baby just fall asleep at the breast, or have the baby pull away from the breast.
How long should a baby be on the breast? There's no exact time limit for how long a baby should nurse. Every baby is different. Focus on ensuring your baby is actively drinking rather than just sucking. If they're only sucking without getting milk, use compressions, switch sides, and repeat the process. Risks of formula feeding. Formula feeding, while sometimes necessary, can come with risks. For the baby, it increases the likelihood of infections, digestive issues, and even long-term health problems. For the mother, it can reduce milk supply and lead to earlier weaning. For the mother, it can reduce milk supply and lead to earlier weaning. That's why Dr. Newman and many experts recommend breastfeeding as the best option whenever possible.
You know, the benefits of breast milk, I never talk about the benefits of breast milk or breastfeeding. I talk about the risks of formula feeding. And anybody that suggests that infant formulas are almost like breast milk hasn't a clue. They're not at all similar. The only similarity between them is that they're both liquid. But if you look at the biochemistry of breast milk and formula, they're very, very different.
Boosting milk supply naturally to increase your milk supply. 1. Get the best latch possible. 2. Watch for signs that your baby is actually drinking, not just sucking. 3. Use breast compressions and switch sides as needed. 4. Stay hydrated. Eat a balanced diet with foods rich in antioxidants, omega-3 fatty acids, and B vitamins. 5. If needed, use a lactation aid while nursing to ensure your baby is getting enough milk and to keep your supply up. Breastfeeding is about more than just breast milk. It's a bond, a learning process for both mother and baby. Start with skin to skin, get a good latch, and use these tips to ensure a successful breastfeeding journey. If you found this video helpful, hit that like button and subscribe for more health tips. Thanks for watching. See you in the next video.